Obsessive-Compulsive Disorder, OCD and in-depth exploration. Introduction. Obsessive-Compulsive Disorder, OCD, is a chronic mental health condition characterized by uncontrollable, recurring thoughts, obsessions, and behaviors, compulsions, that the person feels compelled to repeat. Despite being a relatively common disorder, OCD is often misunderstood and misrepresented in popular culture. This comprehensive examination will explore the nature of OCD, its symptoms, causes, and treatments, and provide a deeper understanding of how it impacts the lives of those who suffer from it. 1. Understanding OCD. 1.1 Definition and Overview. OCD is a mental health disorder that affects people of all ages and walks of life. It occurs when a person gets caught in a cycle of obsessions and compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that trigger intensely distressing feelings. Compulsions are behaviors an individual engages in to attempt to get rid of the obsessions and/or decrease their distress. 1.2 Historical context. The understanding of OCD has evolved significantly over time. Historical records suggest that obsessive-compulsive symptoms were recognized as early as the Middle Ages, but it wasn't until the late 19th and early 20th centuries that OCD began to be understood in a medical and psychological context. Early psychiatrists like Sigmund Freud and Pierre Janet contributed to the foundation of modern understanding, but it was the advent of modern psychology and psychiatry that truly transformed our understanding of OCD. 1.3 Prevalence and demographics. OCD affects approximately 1 to 2% of the population worldwide. It is a condition that affects both men and women equally, and it can manifest at any age, although it typically appears in childhood, adolescence, or early adulthood. The disorder is known to cross cultural and socioeconomic boundaries, making it a global mental health issue. 2. Symptoms of OCD. 2.1 Obsessions. Obsessions are persistent and unwanted thoughts, urges, or images that cause distress or anxiety. Common obsessions include fear of contamination by germs or dirt, fear of harming oneself or others, intrusive thoughts about sex, religion, or violence, symmetry and orderliness concerns, excessive doubt and the need for constant reassurance. 2.2 Compulsions. Compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to rigid rules. Common compulsions include excessive cleaning or hand washing, checking things repeatedly, e.g., locks, appliances, repeating actions, e.g., tapping, counting, arranging items in a specific, precise way. Mental compulsions, e.g., praying, counting, repeating words silently. 2.3 The cycle of OCD. The cycle of OCD typically follows a pattern. 1. Obsession, an unwanted, intrusive thought, image, or urge occurs. 2. Anxiety, the obsession causes significant distress or anxiety. 3. Compulsion, the individual engages in a behavior or mental act to reduce the anxiety or prevent a feared event. 4. Relief, the compulsion provides temporary relief from the anxiety. 5. Repetition, the obsession returns, and the cycle repeats. 3. Causes and risk factors. 3.1 Biological factors. Research suggests that OCD has a biological component. Factors include genetics. OCD tends to run in families, suggesting a genetic link. Studies have identified specific genes that may contribute to the disorder. Brain structure and function. Abnormalities in certain areas of the brain, particularly the orbitofrontal cortex, anterior cingulate cortex, and basal ganglia, are associated with OCD. Neuroimaging studies have shown that these brain regions are involved in regulating emotions, decision-making, and movement. Neurotransmitters. Imbalances in neurotransmitters, particularly serotonin, are believed to play a role in OCD. Medications that increase serotonin levels can help reduce symptoms. 3.2 Environmental factors. Environmental factors can also contribute to the development of OCD, including trauma. Traumatic events, such as abuse or significant loss, can trigger OCD symptoms in susceptible individuals. Stress, high levels of stress or major life changes, e.g., moving, changing jobs, relationship issues, can exacerbate OCD symptoms. Infections, some cases of OCD, particularly in children, have been linked to streptococcal infections, leading to the term PANDAS, pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. 3.3 Psychological factors. Psychological theories also provide insight into the development of OCD. Cognitive theories. These theories suggest that people with OCD have dysfunctional beliefs and thought patterns that lead to misinterpretation of intrusive thoughts, resulting in compulsive behaviors. Behavioral theories. These theories focus on how compulsions are reinforced by the temporary relief they provide from anxiety, leading to a cycle of obsession and compulsion. 4. Diagnosing OCD. 4.1 Diagnostic criteria. The diagnosis of OCD is based on criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which include presence of obsessions, compulsions, or both. The obsessions or compulsions are time-consuming, e.g., take more than 1 hour per day, or cause significant distress or impairment in social, occupational, or other important areas of functioning. The symptoms are not attributable to the effects of a substance or another medical condition. 4.2 Assessment tools. Several tools and scales are used to assess the severity and impact of OCD, including Yale-Brown Obsessive-Compulsive Scale, YBOS, is a widely used clinician-rated scale that measures the severity of obsessive-compulsive symptoms. Obsessive-Compulsive Inventory, OCI, a self-report questionnaire that assesses the presence and severity of OCD symptoms. Dimensional Obsessive-Compulsive Scale, DOCS, a measure that evaluates the severity of symptoms across different dimensions of OCD. 4.3 Differential diagnosis. OCD can be challenging to diagnose because its symptoms overlap with other mental health conditions. Differential diagnosis involves distinguishing OCD from other disorders, such as Generalized Anxiety Disorder, GAD, Major Depressive Disorder, Body Dysmorphic Disorder, BDD, Hoarding Disorder, Trichotillomania, Hair Pulling Disorder, Excoriation, Skin Picking Disorder, Tourette's Disorder. 5. Treatment of OCD. 5.1 Cognitive Behavioral Therapy, CBT. Cognitive behavioral therapy, CBT, is considered the most effective treatment for OCD. A specific type of CBT known as exposure and response prevention, ERP, is particularly beneficial. ERP involves exposure, gradually and repeatedly confronting feared situations or thoughts. Response prevention, refraining from engaging in compulsive behaviors after exposure. 5.2 Medication. Medications can also be effective in treating OCD, particularly selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, Prozac, fluvoxamine, Luvox, sertraline, Zoloft, paroxetine, Paxil, citalopram, Celexa. In some cases, other medications, such as clomipramine, anafranil, or antipsychotics, may be used. 5.3 Combination therapy. Combining CBT and medication often provides the best outcomes for individuals with OCD. This approach addresses both the psychological and biological aspects of the disorder. 5.4 Other therapeutic approaches. Other therapeutic approaches that may be beneficial include acceptance and commitment therapy. ACT focuses on accepting thoughts and feelings rather than trying to eliminate them, and committing to actions aligned with personal values. Mindfulness-based cognitive therapy, MBCT, combines cognitive therapy techniques with mindfulness strategies to help individuals become more aware of their thoughts and feelings. 6. Living with OCD. 6.1 Daily challenges. Living with OCD presents numerous daily challenges, including managing time-consuming rituals and compulsions, dealing with the stigma and misunderstanding of the disorder, navigating social, occupational, and educational environments. 6.2 Coping strategies. Effective coping strategies for individuals with OCD include Establishing a routine to manage compulsions. Practicing mindfulness and relaxation techniques. Seeking social support from friends, family, or support groups. Engaging in regular physical activity. 6.3 Support systems. Support systems play a crucial role in helping individuals with OCD manage their symptoms. These systems can include family and friends, providing emotional support and understanding. Support groups, offering a sense of community and shared experiences. Mental health professionals, providing therapy and guidance. 7. Research and future directions. 7.1 Current research. Current research on OCD is focused on several areas, including identifying genetic and neurobiological underpinnings of the disorder, developing new and more effective treatments, understanding the role of environmental factors in the development of OCD. 7.2 Innovative treatments. Innovative treatments being explored for OCD include deep brain stimulation, DBS, a surgical procedure that involves implanting electrodes in specific areas of the brain to regulate abnormal activity. Transcranial magnetic stimulation, TMS, a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. Psychedelic-assisted therapy, research into the use of psychedelics, such as psilocybin, in conjunction with therapy to treat OCD symptoms. 7.3 The future of OCD treatment. The future of OCD treatment looks promising, with ongoing advancements in understanding the disorder and developing new therapeutic approaches. Personalized treatment plans that consider individual differences in genetics, brain structure, and psychological factors are likely to improve outcomes for individuals with OCD. Conclusion. Obsessive-compulsive disorder is a complex and multifaceted mental health condition that significantly impacts the lives of those who suffer from it. Despite its challenges, effective treatments are available, and ongoing research continues to enhance our understanding of the disorder. By fostering awareness, reducing stigma, and providing support, we can improve the quality of life for individuals with OCD and help them lead fulfilling and meaningful lives. This in-depth exploration of OCD covers the fundamental aspects of the disorder, providing a comprehensive understanding of its symptoms, causes, treatments, and impact on daily life. By delving into the intricacies of OCD, we can better support those who struggle with this challenging condition and work towards a future with improved treatments and outcomes. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.